Greetings to you viewers from across the globe. You're welcome to the show. I'm Adiawa AI for Veegil Media. On the show today, we will be talking about the Nigerian economy and the health sector. Now, as organizations look to enter Nigeria's healthcare sector, understanding major challenges in the healthcare sector takes precedence in driven by the public sector. Currently, 66% of the country's 34,000 health facilities are owned by the three tiers of governments. By that I mean the federal, state, and local. Meanwhile, the private sector, which contributes substantially to provisions of health services, it's also important to note that secondary and tertiary healthcare facilities are mainly located in urban areas, while primary healthcare facilities are prevalent in Nigeria's rural areas. This topic of discussion is pertinent because of major challenges in the healthcare sector in the nation, which are exacerbated by the current sector landscapes. One of the major challenges in the healthcare sector is that people are not aware of the current health issues in which they face. Since most Nigerians rely heavily on medical opinions from unqualified individuals, such as authoritative family members, patients do not feel empowered to learn more about their health, and they are not engaged in decision-making process of improving their well-being. Furthermore, due to the lack of clarity around what illnesses plague citizens, many patients are misdiagnosed with trained staff. There is little investment in the workforce. Misdiagnoses are common. Therefore, many citizens do not seek the medical expertise of a doctor until their condition significantly worsens. Another major challenge here is that the healthcare sector in Nigeria is the inadequate allocation of financial resources to improve and maintain the general public's health. Currently, the existing healthcare resource allocation is skewed, with a high proportion going towards secondary and tertiary care facilities. This means that the people tend to bypass the primary healthcare facilities in search of better care in the secondary and tertiary facilities. The results in inefficiencies and inequities because these centers overburdened with medical issues that can be addressed at the primary level, or rather because care is more expensive at the secondary and tertiary care centers. The inadequate allocation of financial resources can be further illustrated when examining Nigeria's domestic government health expenditure per capita in comparison to other countries. Without the proper financing gains in development in the nation's health sector will also continue to be stifled. With that being said, the amount of money Nigeria should actually invest on a healthcare depends on several factors, such as the health challenges the country's population is currently facing. Now, with me on the show, I have Professor Clement. With me on the show, I have Professor Clement Osime. Professor Clement Osime is a renowned professor of surgery with a specialty in surgical oncology and medical law at the University of Benin, and has also doubled as the attorney of the Supreme Court in Nigeria. Welcome to the show, Professor.
Good afternoon, my brother. How you doing?
I'm fine, sir. Nice for you to join us from your busy schedule.
Thank you very much.
So, in your medical field, sir, how many years have you been in practice, sir?
All right, thank you. Well, I've been in practice for well over 31 years or thereabout. I qualified as a medical doctor in 1991. That probably put that as 32 years. Then, as a specialist, that's again well over 20 years. I've been practicing as a surgeon since 1999. All right, so as a general doctor, speaking generally, for over 32 years, then as a specialist for over 20 years.
Okay. That's nice. That's quite a profile, sir. So what has the
Thank
journey
you.
been for you so far, like in the health sector?
Well, you've given a summary of what we experience in the health sector. One,
Okay.
most of our folks are largely uneducated. There's this tripod we describe: ignorance, poverty, and disease. It's a tripod, they're all related. So when you see an ignorant person, it's likely going to go to somebody who's unqualified at all to treat him or her. And when the situation is got so bad, he will not come to the hospital to get care. At that time, what could have probably been controlled will now be out of control. All right, the case gets worse. So you see there, ignorance. Poverty is also there because if the person was financially empowered ab initio, he will go to a proper hospital to get care. But because the finance is not there, is ignorant, so he chooses to go to a quack who will promise him that one drug will do all the things. And because he doesn't have the financial enablement, he's willing to accept that, as a solution. When the patient is not dying, when virtually there's so much solution with that quack, so okay, come and go to the big hospital. At that time, there's really nothing you can do. So you can see the tripod of disease, ignorance, and poverty. They are closely related, closely knit. Okay, that's the truth of the matter. It's a woven. You cannot really separate one from the other. All right, so that is what we encounter daily. People coming late to hospital, and when you find out why they are coming late, you'll be amazed that they were told to go to one place to get treatment and all that. Of course, don't forget the issue of religion. Several persons abuse religion, and therefore they mislead patients. Several patients are misled by religious leaders. You need to see the amount of fear, amount of respect, if you like, patients have for their religious leaders. And therefore, when the man tells them don't go to hospital, keep praying about it, they just key into that. To close this segment about ignorance and the role of religion in misleading people, only a few days ago I saw a young lady, a graduate. You'll be amazed. We are managing her for toxic goiter, this swallow neck we call goiter. I will try to break it down so the general audience can follow. So we gave her drugs, what we call anti-thyroid drugs, because when she came in, she was toxic. And to that extent, we couldn't do operation for her. So we told her, go take your drugs. When she came for follow-up, she was doing well. And our opinion was, after the next check, she should be ready for surgery. And she was excited about it. Then, before she now came for the last checkup, where we were expecting to get normal results, the result I had before me was completely out of what I was expecting. It now showed that we're almost back to what it was when we started. So I was taken aback. And of course, naturally, I had to ask the girl, my dear sister, have you been taking your drugs? Initially, we were reluctant, reluctant. When I now confronted her directly again, I said, I need to know why we don't give you wrong drugs, why we don't give you overdose. She now open up. I said, actually, I have not been taking the drugs. So what? That's not even her pastor to tell you what I'm saying. Her mother lives in a different city. She lives in Benin. The mother who's on with the patient, who doesn't know what the patient is passing through, told her pastor. The pastor told the mother, tell your daughter to throw away the drugs. She has been healed. I've said the prayers here, she's healed. And I told the girl, if indeed you were healed, I expect that this swelling on your neck should have disappeared. Two, if indeed you were healed, I expect that the thyroid function test we now did will be normal. So that is part of the problem we face. Ignorance, the role of religion, the role of poverty, they are all interrelated. Thank you.
Okay, sir. So, how can all these hindrances be addressed?
Number one, the government has a role to play.
Okay.
How do I mean? There must be regulation. Not anybody can just open an hospital. If your center is not accredited to offer some kinds of services, you cannot operate at that level. You cannot.
Okay.
Only recently, somebody called me through a friend that they were harassing her to close a small place where she demanded they treat patients. I was taken aback. I thought she was a trained nurse. I asked, okay, fine. What is your level of qualification? If I'm to approach the Ministry of Health to say, oh, this woman says she's being embarrassed, harassed, and all that. She's not a nurse at all. Maybe a private hospital or whatever. And yet, she wants to be, So I'm happy that they were able to call her to order. And they said, we're not driving you out of business. They were fair to her. If you want to run a business, do it properly. Get a trained nurse who is 5 years and above in practice that will come and, because it's expected that at that level of experience, a trained nurse will know the do's and don'ts of that center. And go get somebody. We're not saying close your place forever. No. Get somebody, a trained nurse, who can help you operate this place in accordance with the ethics and the laws of the profession. So that's government has a role to play by sanitizing the system to try to flush out quacks. Number two,
Okay, sir. All
health
right, I'll
education,
have
like
another.
health education, like we're doing now. And the populace should know where to go to when they have a health challenge. Health education. And this may be like religion. People should be made to know God for themselves, not relying on somebody. The irony, I will tell you painfully, these same people that tell these people don't take drugs straight away, you are being healed, when they are sick, they come to hospital, we see them. That is the painful aspect of this whole drama. Therefore, people must be encouraged to know God for themselves, not relying on one prophet to tell you, take this, don't take this. Meanwhile, when the prophet is sick, he goes to hospital. The irony of life. It's a paradox, isn't it? You tell me don't
Yes.
take this drug. When you're sick, you come to hospital. Some they come secretly. I know what I'm telling you. But if people are enlightened, they know God for themselves. I do not say miracle don't exist. But what I do say, people must verify this thing. Like I gave you an example. And I thought the girl felt very ashamed. Because nobody has taught her like this. Once the pastor said so, you just swallow it. No rationalization. I said, a pastor told you for 2 months, don't take this drug. The swelling in your neck has increased in size. Your results have gone haywire. The symptoms you were having before we started treating you have all come back. How do you reconcile that? And the pastor tells you a miracle has taken place. So if people are enlightened in this manner, they will know what to accept or not to accept. All right. So to summarize, government has a role to play, flush out quacks, enlighten the audience, let them know where they should go and seek medical attention when they are in need of it. All right. In that case, you're able to. Then people too who are members of churches, members of mosques, they should be involved actively in giving head talks in their various setups, either in the church or in the mosque. Head talks. All right. When there is, don't shy away. When there's a program to do a head talk, be at the forefront. If you're a doctor in that audience, your social communities, corporate social responsibilities, your village meetings. I do that once
Yes.
in a while with my old boys, for example. I can be given
Yes.
5 minutes to talk about health-related matters. 5, 10 minutes, a little clip. You may never know the effect of that little speech you make in 5 minutes, 10 minutes. Somebody who are probably contemplating doing the wrong thing will pick it from there. So thank God I came for this meeting. Thank God I heard this from this, and you would have saved a life or two. Thank you.
Okay, sir. Well, I'll have another question for you, sir.
Go ahead, sir.
From the economic state of healthcare in Nigeria, about 3% of Nigeria's GDP is invested in the health sector, considerably below the average spending on healthcare among OECD countries. Now, these OECD countries are countries with high income, whereas Nigeria, as an emerging economy, belongs to countries with lower middle income. Now, is 3% of the nation's GDP enough investment for the health sector?
Not at all.
Okay.
Grossly inadequate. grossly
Okay.
inadequate. That is why, if you go to most centers, government centers, you have infrastructural decay. I must commend the chief executives. They try by all means, either appealing to good Samaritans, good Nigerians, donor agencies. They do all they can just to keep services going. I'm pretty sure if they were to rely on government alone to fund the system, services will not be rendered. So 3% is grossly inadequate. That is why you don't have, for example, look at Nigeria. How many centers do you have radiotherapy? You need to know the pain cancer patients go through when they have to go and do radiotherapy outside their location. But go to some countries, maybe in the US, you have radiotherapy machine virtually in all the cities. So if somebody has breast cancer, for example, in Benin today, he must necessarily travel out of Benin, either to Enugu, to Calabar, and that discourages many persons. It's naturally more expensive when you go outside your location. Radiotherapy, for example, can last 3 4 weeks to complete a cycle. So you'll be in Lagos in a hotel for that 4 weeks, pay transportation and all that. How many persons can afford that? To that extent, therefore, when we refer patients for radiotherapy, treatment outside location where they are based, they don't go. So we see the patient after 3 months, you say, Madam, have you gone for the radiotherapy? Say, my brother, my doctor, I couldn't raise the money. What I'm saying now, because the money you are putting is so small, you are barely able to even buy the basic things that will allow for daily running of the hospital, not to now talk of try to embark on major infrastructural upgrade. That's a very major challenge, and it has led to delayed treatment. When you now go to the few centers that have it, like if you go to Lagos, for example, you have a long waiting period. If you go to Abuja National Hospital, those that want to take radiotherapy, you have a long waiting period because the number is just overwhelming for the center where they offer such services. So, whereas if the money was available enough, people will now be able to access those things. Then, of course, training too. Training is not there. Most people, when they finish school, the few people that go for training, majority use their personal resources. Whereas the way medicine is structured, people are supposed to go for training and retraining. Training and retraining. You have new equipment coming up, some new diseases coming up, new methods of doing things coming up. Surgeries are no longer done the same way they were done 20, 30 years ago. You have new methods of doing surgery. If the man, if the man doesn't know, one second, if the man doesn't know, or have the resources to sponsor himself, then it's going to be a challenge. It's going to be a challenge. So these are issues. Because the money is small, I mean, when you're looking for money to buy basic drugs, to pay NEPA bills, you can't possibly be thinking of sending Professor Seaman to US to go and spend 1 year to learn one particular procedure or so. Those are challenges that we grapple with in the health sector. The bottom line that the money voted is just too little. Thank you. Okay.
Yeah, on a final note, sir, the nation's GDP, which you've actually been opposed to, being 3%, which of course is definitely not enough to serve the health sector or even those practicing in the health sector. Hence, my next question: what is your take on the brain drain spree? They call it now the Japa sensation, whereby we have capable hands not find themselves in a functional environment or climate to operate in. They end up going to developed nations to actually showcase what is actually deposited in them. So when we have more capable hands, so when we have more capable hands leaving the country, what is our fate when we no longer have
Yeah.
capable hands to help the sick?
I mean, it's obvious. You have said it. When I do the parable, when the wall has collapsed, a small goat can climb it. That is the summary. People are living in their numbers, consultants, professors. living. They are living for several reasons. You may ask, what are the reasons? Number one, poor remuneration for work done. That is a major consideration. So you see very senior doctors, professors going to Saudi Arabia. Very painful. These are people that ought to be at home to teach the younger ones. Those skills they have, you can't buy from the market. If you have a young consultant today who just qualified as a consultant, he can never have the skill, the expertise, the experience. Yeah, he may be very intelligent, no doubt, of that old professor. So the man leaves, he goes to Saudi to go and get more money. You don't blame him. Probably he's unable to build a good house. He can't send his children to school. He cannot drive a good car. The car is driving, help me push her today. Tomorrow, me push it. So the man feels disillusioned. Meanwhile, Saudi is just there, tempting you to come. Please, can you come over? Can you come over? And they give you very juicy offers. And majority want to go for it. Few people refuse to be tempted. There are personal, issues. They refuse to be tempted. They look at a global family view, that money is not everything. Few persons, they don't get tempted with that offer. That look very tempting, really. If you hear what they are paid and what you are paid here, somebody can actually think if you do not go to Saudi or those good countries, you are probably out of your mind. But some persons will say no. Some only few are really patriotic to their fatherland. Very few. Majority is because of the strong attachment to the family's tie. You have young children, they are still in school. You don't want to go and train them in such an environment. Oh, let them train in Nigeria. Let one partner, either the wife or the husband, stay with the kids and let them develop here. Maybe after university before. So that's the reason why you see some people who are not going are stay behind. Not necessarily for patriotism and all that. That's the truth of the matter. They may tell you on the
Thanks
surface.
for creating time out of your busy schedule, Professor
Okay,
Clement
so
Osi,
maybe just to add,
Professor
so there are
Adrian,
poverty,
with
poor pay.
specialty in
If
surgical
exposure is not
oncology
there,
and medical
no
law.
satisfaction. That's why they don't stay.
Thanks for having
Thank
us,
you.
sir.
Thank you very much.
Professor Clement Osime. It is our view that the governments can actually swing into action speedily to address the inadequacies or challenges facing the health sector. I'm a DIY AI for Visual Media. Thanks for sticking around.